This segment of Delmarva Life is brought to you by TidalHealth.
Picture it. You're at home enjoying time with your family, and suddenly a part of your body goes numb. You also find it difficult to speak. What's going on? Well, these are both signs of a stroke, and time is not on your side. It's a scary situation, a situation that TidalHealth Peninsula Regional Neurosurgeon Dr. Sophia Shakur is here to talk about as part of National Stroke Awareness Month. Thank you for being here, Dr. Shakur.
Thank you for having me.
So first of all, let's start with the basics. What is a stroke, and how do you know if you're experiencing one?
Sure. So a stroke is a sudden injury to the brain without trauma. So it happens suddenly, usually out of the blue. A person might just be sitting down, having coffee. They might be standing, walking, or even asleep. And it can be caused either by a blockage in a blood vessel in the brain, where the brain is not getting enough blood flow, or it can happen if a blood vessel actually ruptures in the brain and causes a bleed. So certainly you would need medical attention right away, and it's important to be able to recognize a stroke. So the easiest way is to remember the acronym B FAST.
Okay.
So B stands for balance. So if you have trouble with your balance or walking, E is for your eyes if you have trouble seeing. F is for face if you notice a facial droop. The A for arm if you have arm weakness or you can't move your arm. And then S is for speech. So if you have slurred speech, difficulty speaking. And then the T is for time. If you notice any one of those or any combination of those symptoms, it's time to call 911.
Yeah, definitely. Now, as a neurosurgeon, how can you help patients who have experienced a stroke?
Yeah, so as a neurosurgeon, as one of the neurosurgeons at TidalHealth, I specialize in vascular problems in the brain. So that means that I treat patients with strokes. These days, a lot of the surgeries are done with minimally invasive techniques. We call them neuroendovascular techniques with catheters and wires.
Yeah, and you're the only surgeon within 100 miles or more that actually specializes in that minimally invasive neurosurgery. Tell us a little bit more about what it is and the technology you use.
Yeah, so minimally invasive neurosurgery, we can also describe it as neuroendovascular surgery, is a surgical technique where we use catheters and wires. So traditional brain surgery is done by shaving some of the hair on your head, by making an incision on the head. But with these newer techniques, we can actually do the surgery with just a puncture, a needle puncture in the groin, in the leg area. And then we use catheters and wires to get all the way up to the head and to treat the blood vessels in the brain where the problem is. So there's no incision at all. And certainly the recovery is easier for patients. Oftentimes the outcomes are better. And it's as safe and as effective, if not more safe and effective, as the traditional techniques.
And you use a hybrid operating room. What is that?
That's right. So at TidalHealth Peninsula Regional in Salisbury, we have something called the Neurosurgery Hybrid Operating Room, which is a special operating room. It's a surgical suite in the main operating room area. It was the first of its kind in the state of Maryland. It's very special because you can do traditional brain surgeries in that room, but at the same time it has a biplane x-ray machine where you can do the neuroendovascular and minimally invasive procedures as well.
That's amazing. And of course, TidalHealth Peninsula Regional also helps with the recovery from the surgery?
That's right. So we have a big team. Anytime you do surgeries like this, anytime you take care of stroke patients, it requires a team approach. So at TidalHealth, you know, our emergency room department, radiology department, our neurologists, critical care doctors, we all work together to make sure that patients do well. Additionally, we have stroke support groups for patients and their families who are recovering from strokes. And that's located both in Salisbury and in Seaford at TidalHealth Nanticoke.
We're so fortunate to have TidalHealth here on the peninsula. Dr. Sophia Shakur with TidalHealth Peninsula Regional, thank you so much.
Oh, thank you for having me.